Have you ever asked yourself, is it still safe to masturbate at my age? Or maybe you've been noticing some changes lately. Less sensitivity, discomfort afterward, maybe even guilt or confusion about something that's supposed to feel normal or even healthy. You're not alone. In fact, millions of older men are quietly dealing with the same questions, but very few are getting the right answers. And unfortunately, misinformation, or worse, silence, can lead to unnecessary fear, pain, or even long-term health issues. So let's change that today. Hi, I'm Dr. Alex Carter. I'm 70 years old with over 45 years of experience in medicine. I hold advanced degrees from top medical universities and have spent decades helping people live healthier, stronger, and more active lives, especially as we age. Through my journey as a doctor, and yes, as a man who has aged too, I've learned one powerful truth. Simple habits can make a big difference. And today, we're going to talk about a topic that many shy away from, but one that deeply matters to your well-being: masturbation and men's health after 55. We're going to cover the real effects of masturbation on the aging male body, when it's healthy and when it's not, surprising risks you may not have considered, how to do it safely with better outcomes for your mind and body, and how your overall health, from your prostate to your heart, may be connected. Whether you're watching for yourself, your partner, or even your aging father, this is a safe, shame-free space to learn the facts. Let's begin. What actually happens to your body when you masturbate after 55? Let's start with the basics. Masturbation is not inherently harmful. In fact, when done with awareness, it can actually support your physical and emotional health. But as we age, our hormones, circulation, and tissue sensitivity begin to change, and that changes how our bodies respond to stimulation. Here's what's going on inside you. 1. Testosterone levels decline. After age 30, testosterone begins to drop by about 1% each year. By your 60s or 70s, you may have significantly lower levels than you did in your youth. Why does that matter? Testosterone fuels your libido, supports erectile function, muscle mass, bone density, and affects the intensity of orgasm and pleasure. If your interest in sex has dropped or you're not feeling the same satisfaction as before, it's not all in your head, it's biological. Regular sexual activity, including masturbation, can help maintain testosterone circulation, but it must be done mindfully, especially if you're dealing with heart or prostate issues. 2. Blood flow and circulation may be weaker. Your erections depend on strong blood flow, but over time, arteries may harden, especially if you have high blood pressure, diabetes, or cholesterol issues. This can lead to weaker erections, delayed orgasms, or total lack of arousal. And if you're straining yourself, using forceful methods, or not feeling any sensation, you could injure your tissue or overwork your pelvic floor. Studies have found that moderate, healthy masturbation can help to improve pelvic blood flow, reduce prostate stagnation, and even lower stress, if done safely. 3. Your prostate becomes more sensitive. The prostate plays a crucial role in semen production. As men age, it often enlarges, a condition called benign prostatic hyperplasia, or BPH. You may notice frequent urination, dribbling, pelvic discomfort, or even pain during ejaculation. If you're masturbating regularly and experiencing any of the above, it may be time to change your technique or reduce frequency to avoid aggravating the prostate. So, is masturbation healthy or harmful for older men? The answer is, it depends on how you do it, how often, and what health conditions you may already have. Potential benefits of conscious masturbation: supports prostate health, may lower the risk of prostate cancer, improves mood and reduces stress, enhances sleep quality, strengthens pelvic floor muscles. If done too frequently, it can have the opposite effect. Potential risks if done excessively or aggressively: pelvic floor tension, chronic pelvic pain, erectile dysfunction, prostate irritation, emotional guilt or isolation. How to masturbate safely and consciously after 55. Here are 5 science-backed tips for doing it safely and consciously. Tip 1. Be gentle and use lubrication. Skin gets thinner and drier with age. Always use a water-based, unscented lubricant. Take your time. Avoid intense squeezing, pulling, or awkward positions. Tip 2. Space out your frequency. Your body needs more recovery time. For many older men, 2 to 3 times a week is healthy. Pay attention to energy, discomfort, or sleep patterns afterward. Tip 3. Include breath and relaxation. Shallow breathing creates tension. Practice slow, full breathing and keep your body relaxed. Tip 4. Watch your posture. Poor posture can compress nerves and cause pain. Use a neutral position, support your back, and move if you feel numbness or tingling. Reframe the mental narrative. There's no shame in caring for your sexual health. Treat it with respect, like any other wellness habit. FAQs and common concerns. Can masturbation cause prostate cancer? No. In fact, regular ejaculation may reduce the risk. I feel tired after I masturbate. Is that normal? Some fatigue is normal. If it's extreme, consider hydration, nutrition, or hormone levels. I use adult videos. Is that harmful? In moderation, it's okay, but overuse can dull sensitivity or create unrealistic expectations. Can masturbation affect my heart? Sexual activity raises your heart rate and blood pressure. If you have heart conditions, consult your doctor. If you can climb 2 flights of stairs without pain, you're likely safe. I feel ashamed even asking about this. Is that normal? Yes, but you're not alone and you deserve clear, respectful answers. Special considerations for specific health conditions. If you have diabetes, watch for reduced sensitivity, longer recovery, and dry skin. Use lubrication and manage your blood sugar. If you're on prostate medications, you may experience reduced semen volume or different sensations. This isn't dangerous, just different. Talk to your doctor if concerned. If you have cognitive decline or are a caregiver, respect, privacy, and boundaries are essential. Involve professionals if needed. Recap and final thoughts. Masturbation can be healthy for older men when done mindfully and in moderation. Avoid overuse, aggressive techniques, or guilt. Take care of your body and your mind. You deserve to feel good, have clarity, and enjoy your body at any age. If this helped you, like the video, subscribe to the channel, and leave a comment with your questions. I'm Dr. Alex Carter. At 70 years old, I'm still learning, growing, and living with strength, and so can you. Stay strong, stay curious, and I'll see you in the next video.